From the very young to the very mature, both athletes and weekend warriors competing at all different levels. Those are the patients that I see in the office. I also see work-related injuries that require special attention to get those patients back to work in a timely and safe manner. I also see patients that just need to be looked at to get back to their regular activities of daily living. When I first see a patient in the office, I assess their history, get an idea of whether it's an injury or whether it's something that's been ongoing that's chronic, such as arthritis. I get an idea of how bad their pain is. I get an idea of how it affects their activities of daily living, what they can and can't do, whether they sleep at night. If they can't sleep and it's really affecting their entire life. Those are things that we look at in the history, and whether they've had any treatment in the past. Once we get the history, then I move to the physical examination, where I examine the body part involved, look at any atrophy or any deformity, any prior surgeries, incisions that may be present, and look at their motion, both active and passive, look at how stable the joint is, whether it makes any noises, anything that's abnormal, whether the joint is stable or not, because some patients present with instability of the shoulder or knee. Then after that, we move on to any radiographic studies they may have. So if there are any x-rays or MRIs, we review that. From then, I make a diagnosis as to what their symptoms are related to. Once we get the diagnosis, then we look at treatment options for that particular patient. So there's non-surgical treatment options and surgical treatment options. And each one has to be customized to that patient as to what's going to bear the best benefit for that patient. A lot of patients I see in the office don't require surgery. And so we like to institute what we call non-surgical treatment options. Those options include physical therapy, injections such as cortisone or lubrication type injections for arthritis, medications such as anti-inflammatory medications that help reduce pain, and sometimes bracing even helps. In those cases where a patient does need surgery, we have a lot more options available through different techniques and different technologies that have been developed to actually foster better rehab, better outcomes for patients. I think of the rotator cuff repair. We now have better implants to hold the rotator cuff in place. We have patches that we can use that biologically heal the rotator cuff as well. And so those are ways that patients can really recover a lot quicker and have better long-term outcomes as well. For those patients that present with debilitating pain, can't do the things they love to do, and I'm able to fix their problems, watching the joy in their face and the fact that they can get back to those activities that they love is the most rewarding part of the job.